Okay, this is a very brief lecture on how health insurance affects the health care market. In this first diagram, we see there's no health insurance. We simply have a regular demand curve for the demand for health care, and we have a supply curve. And the prices go up, more health care is supplied, and less is demanded. And it reaches an equilibrium here, which is the price of health care and the quantity that's provided. Now, if we introduce health insurance into this, what we have is the second diagram here, where there's a demand curve for the out-of-pocket demand. That is what the patient or the patient's family pays for the health care, what they would be demanding at various prices. And in this case, we have our old equilibrium put into place here, and we have the quantity that's demanded, and which is also supplied at the price P1. But health insurance introduces a new demand curve. That is that the patient is only paying a certain amount, but the health insurance, and it doesn't matter if it's private or public, but the health insurance increases the amount that the patient and the patient's representatives are able to pay for the same amount of health care. So this higher demand curve introduces a windfall because the same supply is provided by the healthcare providers, but at a P2 price instead of the P1 price. And then what happens is the next diagram shows is that the increased supply, the increased amount of money that's being given to the healthcare professionals is inducing a greater demand for the healthcare factors. These are the things that go into healthcare, providing healthcare, whether it is the medical degrees, whether it is the medicine, whether it is the equipment that is used, whether it's the supplies. All of those are finding that they are having more money thrown at them from all these healthcare providers getting a windfall. Now, of course, there's other factors that come into the play as they are becoming incredibly wealthy. For that, you have doctors filing, lawyers filing lawsuits against doctors, malpractice suits, and so on, and you get that legal harassment that's trying to cash in on some of that windfall. All of those taken together is increasing the cost of medical care. And that's seen on this as well, because now we have the supply curve that was providers before insurance, and now we have a supply curve for providers after insurance, and this reaction to the windfall, what I call the backfilling of the healthcare costs, the factor costs for the doctors, factor prices to the doctors. This then comes back to here, and now P2 becomes the new P1, and another P3 windfall is provided, and then another backfilling of the healthcare factors is increasing the price of medical care even further. That's what produced the skyrocketing healthcare costs that were experienced in the decade from the mid 20th century until now. There's only one way to get out of this constant escalation of healthcare prices and healthcare costs, and that is to abolish health insurance. Just eliminate it. No Medicare, no Obamacare, no Blue Cross Blue Shield, nothing. None of them. Rule them out entirely, because then you'll end up with what the market can pay, back to the square one. Second part is to realize what health insurance was claiming to try to correct, try to help out with, and that is that people need to be cared for. And they had been in previous cultures. The medicine man effectively was working for free. The medical doctors out in the countries were getting paid in chickens and suits and whatever. Uh, and they weren't charging an arm and a leg. They wanted to make sure that their patients were healthy, both physically and also financially. They weren't trying to fleece them. And they certainly didn't want to have this mess that health insurance created. So second part is that we need to establish municipal medical departments. And they would act similarly to a fire department in a town, or a first aid station, actually. It's a closer analogy. And they would provide medical care free to the people. How are they going to get paid? They're going to get paid by the town. How we're going to accomplish that with all the budget stress that's going on? What we do is that we pay all of the medical providers as staff on these municipal medical departments. And they're paid through a combination, mostly of federal funding and some state possibly as well. But the idea is that they are maintaining the standards of health care at the federal level, and they're getting paid. They're paying the doctors, they're paying the nurses, they're paying the x-ray technicians, the CRTers, all these various people are getting paid on salary. So it doesn't matter who's coming in, whether it's a high demand or a low demand, it's taken off market and is provided as a civic service, as a civic institution for every town, for every borough, for every city. And it's kept in place by treating all the doctors, all the medical staff as civil servants. They're getting paid on a fixed scale, and obviously it will be at a higher scale, a higher rate at the beginning. But there's another feature of the municipal medical departments that we need to realize here is that they're also going to teach the doctors. They're going to train the doctors. The municipal medical departments will have a school program that will start at the local public education, local school level, and proceed all the way up to getting your medical degree and further doing medical research. So the municipal medical departments deal with the problem of how are we going to get enough doctors into play right there. We'll have the schooling. People will be able to go to medical school without a cost to them, other than their academic skill, their academic willingness, their drive to become medical staff. In this way, we will provide medical care free to the people and part of a civil service program that will ensure a steady supply of well-qualified doctors, nurses, and technicians to serve the people throughout the country. And that's the plan. Thank you for watching.